Life is made up of promises, and from early on, we learn that hard lesson. Some promises are broken.
I tried to give birth to my promises, nothing.
G8 summits are full of promises.
Overdue.
Commitments leaders make to tackle the world's worst ills. This G8 was no exception, as Prime Minister Stephen Harper unveiled the Muskoka Initiative, an aid plan to boost maternal and child health.
The G8 has committed an additional $5 billion US over the next 5 years, and with our partners, as I mentioned yesterday, bringing the total to $7.3 billion on the Muskoka Initiative on maternal, newborn, and child health.
Canada's contribution was over $2 billion.
Congratulations!
The other G8 countries, well, not so much.
There was a lost opportunity with the Muskoka Initiative for the rest of the G8 nations to come forward in a really meaningful way. The $5 billion that was produced by those G8 countries is simply not enough.
This stunt was set up to draw attention to the issue, though lack of awareness could be what prevented people, including G8 leaders, from really getting behind the initiative, according to Robyn Bright.
Sometimes when we talk at child and maternal health, and people are saying, "What is that? What does that mean?" And being able to bring that, unpack it a little bit for for churches and to help people understand what that is. And I think we're having a bit of a crisis of, in the midst of economic pressures, do we still want to stay true to our commitments to the poor?
Bright is head of Micah Challenge Canada, an advocacy group to mobilize the church and government to live up to the Millennium Development Goals. Which brings us back to promises. In 2000, 192 United Nations member states agreed to cut global poverty in half by 2015. Of all 8 goals, the ones that have fallen most behind are 4 and 5. To reduce child mortality and improve maternal health. And that's why so many worked so hard to get this on the G8 agenda.
It just takes persistence. So we came up with the idea, this government's really committed to effectiveness. They want to have metrics where they can measure it. They want it practical. What's more practical, first of all, with children, for example? And then you can't talk about healthy children if you're not talking about healthy mothers.
Dave Toycen of World Vision Canada and David Morley of Save the Children Canada were part of the NGO coalition that laid the groundwork for the Muskoka Initiative. It was a huge victory, but one tainted with controversy over abortion.
We stopped talking about children. We only started talking about that issue, and I think the message did get changed, sadly.
Still, $5 billion is nothing to sneeze at, and will make a big difference in the lives of mothers and children in the developing world, where 99% of these deaths occur.
Oddly enough, it was another Harper initiative, accountability, that could have led to the lower than expected numbers for maternal health. That's because there's never been such a push to make sure what's committed at the G8 table actually takes place.
And that's good news, according to Toycen.
What are pledges worth if they don't actually come true? But I do think that's probably driven some of the commitments down. I think the other issue is that they're all struggling with financial situations of one sort or another, so I think it's a tough environment. But I think the disappointment that I feel is that people don't understand that investing in something like child and maternal health is also an investment in the economy.
That's why Africa has a place at the G8 table. It has more to lose than any other continent in the maternal and child health crisis.
Progress is possible if we invest in the right things. We don't only depend on each other when it's a security issue. We also depend on each other when it's a human development issue, when it's an education issue. And I think that should be at the center of international relations.
So what will come of the Muskoka Initiative? And will these promises made be kept? Ella Kakotsis of the University of Toronto's G8 Research Group will be watching.
We've actually been tracking compliance with the G8's commitments since 1996 here at the Munk School of Global Affairs, part of our G8 Research Group program, and it's one of our key deliverables. The report this year, which tracks compliance from last year's L'Aquila Summit in Italy, from then until now, a year out, is an almost 400-page document which gives a very in-depth analytical breakdown of 20-plus core commitments across the entire G8 spectrum of issues.
Though the track record is far from perfect, Kakotsis says Canada is leading the charge to make sure these conferences have real consequences.
The government of Canada certainly is pushing its G8 partners to disclose how they're doing in terms of the commitments they've made at the summit, and to continue this process forward, and to perhaps expand it beyond just development commitments and look at the full spectrum of issues that are covered by the G8.
The promises made to fight maternal and child mortality at this year's G8 may have left some disappointed, though it's important to hold on to one thing.
Hopeful! Hopeful!